Have you ever wondered if there's a way to reclaim your confidence, your vitality, and yes, even your intimate life as you age? What if I told you that science has a solution that's been quietly transforming lives for decades, a solution that's permanent, reliable, and within your reach? Hi, I'm Dr. Anna Schneider, a physician with over 20 years of experience helping people just like you thrive in their golden years. Today, we're diving into a topic that's often whispered about but rarely understood: penile implants as a fix for erectile dysfunction, or ED. Stick with me, because this isn't just about medicine, it's about taking back control of your body and living with pride at any age. Let's get started. First things first, let's talk about why this is worth your time. Aging is a privilege, but it comes with challenges, and for men, one of those challenges can be erectile dysfunction. Did you know that by age 70, over 70% of men experience some form of ED? That's not a small number, that's millions of lives affected worldwide. And here's the kicker: only about 25% of those men seek help. Why? Stigma, shame, or maybe just not knowing there's a solution that works. As a doctor who's spent decades working with older adults, I've seen the toll this takes, not just physically, but emotionally. ED isn't just a bedroom issue, it's a confidence issue, a relationship issue, a you issue. But here's the good news: you don't have to accept it as just part of getting older. You're stronger than that. You've built a life worth celebrating, and your health, all of it, deserves the same fight. So, what if a penile implant could be the key? Let's break it down together. Okay, let's get into the nitty-gritty, but don't worry, I'll keep this simple and friendly, like we're chatting over coffee. A penile implant is a medical device surgically placed inside the penis to help men achieve an erection when they want one. Think of it as an internal support system, discreet, reliable, and totally under your control. There are two main types. 1. Inflatable implants. These are the most popular. They involve a small pump placed in the scrotum and fluid reservoirs in the abdomen. When you're ready, you press the pump, and voila, an erection that feels natural and lasts as long as you need it to. When you're done, you release it. Simple, right? 2. Malleable implants. These are semi-rigid rods that keep the penis firm but flexible. You just adjust it into position when you need it. Less tech, still effective. Now, I know what you might be thinking: surgery? That sounds intense. And yes, it's a procedure, typically about an hour long, done under anesthesia, but here's the reality: the success rate is incredible. Studies show over 90% of men who get penile implants are satisfied with the results. That's not just a statistic, that's a life changed. Here's where the science gets exciting. Unlike pills or injections, which only work temporarily and can lose effectiveness over time, implants are a permanent solution. Once it's in, it's yours, no refills, no fuss. And for men with severe ED, say, from diabetes, prostate surgery, or vascular issues, this can be a game changer when other treatments fail. What do you think? Does that sound like something worth exploring? Now, let's clear up who this is really for, because there's a lot of confusion out there. Penile implants aren't for everyone with ED, and that's okay. They're typically recommended when other options, like medications such as Viagra or lifestyle changes, don't work anymore. Maybe you've tried the little blue pill and it's let you down. Maybe injections feel like a chore. If that's you, listen up, this could be your turning point. But here's a myth I hear all the time: Dr. Anna, isn't this just for younger guys? Absolutely not. I've had patients in their 70s and 80s who've chosen implants and told me it's the best decision they've ever made. Age isn't the limit, your determination is. Another myth? It'll feel fake. Wrong again. Partners often can't tell the difference, and neither can you once you're used to it. Let's talk numbers. About 20,000 penile implant surgeries happen every year in the US alone. That's 20,000 men saying, "I'm not done yet." And here's a fun fact: the first successful penile implant was done back in 1973, over 50 years ago. This isn't new, it's proven. So, I want to hear from you in the comments. What's the biggest myth about ED you've heard? Let's bust it together. Okay, let's shift gears for a minute. As a doctor, I could talk science all day, but as your friend, I want to talk about what this really means. ED can chip away at your sense of self. I've had patients tell me they feel less of a man because of it. And every time I hear that, my heart breaks, because it's not true. You are not defined by a condition, you're defined by how you rise above it. A penile implant isn't just a fix for your body, it's a boost for your soul. Imagine waking up every day knowing you've taken back control. Imagine the relief of not worrying about whether a pill will work tonight. Imagine looking in the mirror and feeling proud of the fight you've fought. That's what this is about. I'll never forget a patient of mine, let's call him John. He was 68, a retired firefighter, tough as nails. ED hit him hard after prostate cancer treatment, and he thought his intimate life was over. After his implant, he came into my office grinning ear to ear. "Dr. Anna," he said, "I feel like me again." That's the power of this choice. So, tell me, what would feeling like you again mean to you? Drop it in the comments, I'd love to hear your thoughts. Alright, let's get practical, because I know you're curious. What's the process like? First, you'll talk to a urologist, a specialist in men's health. They'll assess your situation, your health history, and whether an implant's right for you. If you're a candidate, the surgery itself is outpatient, you're in and out the same day, usually. Recovery takes about 4 to 6 weeks, and yes, there's some discomfort at first, but most men say it's worth it. Cost-wise, it varies. In the US, it can range from $10,000 to $20,000, but here's the good news, Medicare and many insurance plans cover it if it's medically necessary. That's a big deal. Complications are rare, infection rates are under 2% with modern techniques, and the devices last 10 to 15 years on average. Some even longer. Here's a question for you, if money or fear weren't an issue, would you consider this? Be honest with me in the comments, I'm here to listen, not judge. Section 6, the bigger picture, aging with power. Now, let's zoom out. This isn't just about penile implants, it's about how we approach aging as a whole. Too often, I see people, men and women, give up on their bodies as they get older. Oh, I'm 70, what's the point? The point is you. You've got decades of wisdom, strength, and stories, why let your health hold you back? As a geriatric specialist, I'm here to tell you, your 60s, 70s, 80s, these can be some of your best years if you fight for them. Eat well. Move your body. And yes, take charge of issues like ED. A penile implant might not be for everyone, but the mindset behind it, refusing to settle, that's universal. You're not just aging, you're thriving. And I'm proud of you for even watching this video, it means you're curious, you're open, and you're ready. So, here's a little challenge, what's one thing you're going to do this week to take control of your health? Maybe it's a walk, a doctor's appointment, or just talking to someone you trust. Share it with me, I want to cheer you on. Well, we've covered a lot today, from the science of penile implants to the power of owning your health. I hope you're walking away with 2 things, knowledge and hope. If this resonated with you, hit that like button, it tells me you want more content like this. Subscribe if you haven't already, I'm here every week with tips to help you age like a champ. And please, drop a comment below. Tell me, where are you watching from? Are you in New York, London, Sydney, or a small town somewhere? What's your biggest takeaway from today? Maybe you've got a question about implants or ED, I'll do my best to reply. Let's keep this conversation going, because you're not alone in this, and I'm here as your partner in health. Until next time, this is Dr. Anna Schneider, reminding you, your age is just a number, but your strength? That's forever. Take care, and I'll see you soon.